And yes, and so you raise, I think, the really important point that there are trade-offs, and we're going to have to make informed decisions. I'm very worried in my own country at the moment. We, like the United States, are a federation. So many of the states here have imposed incredibly severe boundary restrictions, border restrictions, but the premiers and the state governments don't wear the political cost of those tough decisions, which are very popular. The Commonwealth does, because the Commonwealth's providing the financial support for people who are out of work or looking for work in these very difficult circumstances. So at vast cost to the next generation, we're keeping our economy going, but the damage is being exacerbated by the lockdowns. And this leads us back to the whole crippling Western problem, if I can put it that way, of no longer being able to have rational debates about trade-offs. And I'm wondering just how much economic and social damage we're going to do if we can't advance this debate. And yet, on the other hand, if it's not conducted rationally and sensible precautions are not taken, you get the sort of problems in areas that you've seen in America.
Yeah, I mean that's what I'm really afraid of too. We have premised our policies on this, I think, false idea that somehow we can just go back to a time before the disease was here and eliminate the disease. That is not true. It's not possible. We have to accept reality and say, okay, how can we learn to live with this disease and this epidemic? And the cost of the lockdowns shouldn't be more than the cost of the disease. And it's hard because, as you pointed out, in the Australian context, and it's true everywhere, the cost of the lockdowns fall on different set of people than the people who get the disease. You're making choices between lives and lives on one side, lives on the other side. The issue is that the lockdown is going to impose costs on different people than COVID will. And it's not simply dollars. I mean, unemployment, of course, is bad, is dollars, but it's also lives, right? So suicides, actually unemployment itself and economic damage itself poses cost on health. And we know that that's long-term costs. Life expectancy goes up with rising income. I was looking at the IMF forecast for Australia, and it says right now it's 4.5% reduction in GDP just for this year.
Yeah,
and that's before the most recent shutdown.
Well, exactly. It will be more. And that, as a former legislator and somebody who's at the heart of an economically reformist government, that, I've said it many times before, and some of my people will write in and say, stop telling us, but we actually eliminated all Commonwealth debt in Australia. And now we're flat out going back into serious debt, and our children are going to inherit that. And it will impact on their lives. But just on the non-economic costs, and I must say I'm very critical of some of the media who are all for lockdowns to save people's lives. And of course that's important, but it can be, very emotionally lopsided, or lopsided in terms of the emotions that feeling plays to, or those reporting plays to. There's modelling conducted by Sydney University's Brain and Mind Centre, and backed, I'm told, by the Australian Medical Association, says that the annual rate of suicide in this country can rise from an already pretty staggering 3,000. I mean, in a country like Australia, we are so fortunate, it's already 3,000, to 4,500, another 1,500. That is, suicides, and youth suicides would make up half that increase. It's a very powerful pointer to some of the human, not economic costs of these lockdowns that are not being taken into account.
I mean, John, that has me very, very worried. The suicides themselves, but also even more broadly, we're asking our youth to pay the costs of that's who pays these costs of these lockdowns. You have delayed schooling, essentially schooling online instead of in person. We have, young people are meant to be in company with one another. We're not meant to be alone. It's extremely costly from a social development point of view to have that, and it's those young people that are paying those costs. It's fine for me. I can sit in my nice office and talk with Zoom and keep doing my job. That's fine. But it's also poor people that are paying the cost. The people who can't afford to do what I'm doing. I think that the unequal distribution of this is absolutely devastating. It's poor people and young people that are paying the cost of the lockdown. not they're not the ones that are benefiting because they are experience the damage of COVID at a much lower rate. So that is the poor people, the young people.
And that, this leads into another concern I have about what's happening in the West with our atomization, the fracturing of our society, where, if you were from Mars, you'd say we all seem to be at war with one another, gender lines, race divisions, and what have you. But now we're heating up an intergenerational battle as well. And I think that is really troubling. The blunt reality is that even when this is over and we've found some accommodation and returned to some degree of normality, assuming we do, the debt hangover will fall unbelievably on the shoulders of young people. And I find that deeply disturbing. They will be very resentful. Many older people will not only be probably insulated, but in following on the pattern since the great financial crisis, their assets seem to go up in value. They become wealthier, and younger people are locked out of the opportunity to advance their housing interests and their lives. So I just don't think enough account is being taken of these things.
I agree with you, John. I mean, I think in the United States, I think we're at $27 trillion in debt and counting. And there's a debate over how big the next stimulus package is going to be. Where does that money come from? Partly it'll come from me. I'm 50. I'll have to pay for it for some time. It's going to come from my kids. It's going to come from the younger generation who will have that debt hanging over them for the rest of their lives. Is it worth it? I mean, that's the thing. It's like we almost haven't asked that question. We just said, okay, we have this COVID disaster. Let's pay any cost whatsoever to get out of it.
Yeah. But it's not, as you said, it's not just economic cost, the social cost, and even the cost to lives, as the Sydney University study suggests, may be far higher than the actual disease imposes on us, and it's not being reported. People are not having this information put before them. So I hope as many people as possible listen to this and ask the sort of questions that arise out of it.
Yeah, I think it's if you want to make rational policy, you need to have projections, right? So it's inevitable, and we've seen our fill of disease projections. I mean, they're everyone is talking about what will the track of COVID look like if we lock down, if we don't lock down. What do these epidemiologic models say? And it's completely reasonable. One ought to have them. But at the same time, side by side, when you're making a decision about a policy, you want to look at both the benefits and the costs. We should have projections about the lives that'll be the cost of these lockdowns, the cost in lives of these lockdowns. What health costs will there be? What mental health costs? What suicide rates? What unemployment? How many people will lose their jobs and thus not develop experience so they can their human capital so they can constructively engage with the labor market later. And we know all that kills as well, right? It's not simply costless. I lose money and I go on with my life. If you cut down schooling, less well-educated populace will be less healthy 10 years from now. So I think and you can say, look, these are uncertain. That's true. They're uncertain. That's why we have models to try to address that uncertainty as best we can. And the disease models themselves are uncertain. They haven't done a very good job either in tracking the disease, as you probably know, in projecting the disease. So it's uncertainty on both sides. It's not an excuse not to consider both all the costs and the benefits together when you're making decisions about policy.
Do you feel we can do better? How do we do better at engaging people in a real debate about the trade-offs and the need to make more rational decisions? Because we're not very good at it now in our cultures. We were once, but we're not now. How can we get a better debate around this so we get better policies for the sake of our children in particular?
John, I think part of it is we have to address our fear first and foremost. I mean, I think that more than anything else has driven the division over COVID policy. This abject fear of what the disease is. It's a deadly disease. One should be concerned, but should one put aside one's rational faculties in order just because of that fear? It makes no sense. Let's look and see, okay, how deadly is it? Let's actually consider all the costs and all the benefits. I think we have to get back to that kind of thinking, that there are trade-offs. We can't live in a utopian world where we can pretend that the virus will somehow disappear if we just shut down hard enough. If we just pay enough pain and cost, it'll go away. I mean, that's not feasible. I think that kind of reality, I'm actually, in some sense, John, I'm kind of hopeful. I mean, I think I'm starting to see some sense that, look, we have to think about the cost. I saw just yesterday, I saw a story that apparently in South Korea, there was a massive protest over this very severe lockdown they've had for a very, very long time. People around the world are feeling these costs, really feeling them. And again, it's not just to their pocketbooks, it's their entire lives. Like, what is the purpose of our lives if not to live them? So I think that kind of thinking will start to take over, because it's too real, John. I mean, you can't just pretend like it's going to just end. When will it end? We hope for a vaccine. I hope for a vaccine, but do we really premise all of our livelihoods on whether a vaccine can be produced in an absolute record amount of time? I mean, I mean, we should invest in it. We should do the science as rapidly as we can, make sure that the data on it are clear so that we understand if the vaccine is produced, it's safe. But should we bet our entire society on that one outcome? Seems like an unwise bet.
Thank you for watching this episode. We appreciate your support. If you value vital conversations like this one, be sure to subscribe to the channel there, and also click the notification bell to stay up to date with new releases.